Okay, welcome to the next important class in the discussion of pharmacology. So this class will study about skeletal muscle relaxant. So with any other group of medicine, in the name itself we have lots of information. That is, so in the name you can see it's skeletal muscle. So what is the target? You can see it's skeletal muscle, and what it causes? It causes relaxation. So ಹೆಸರೊಳಗೆ ನಮಗೆ ಅರ್ಧ ಇನ್ಫಾರ್ಮೇಶನ್ ಸಿಕ್ತು. ದಟ್ ಈಸ್ ಸ್ಕೆಲಿಟಲ್ ಮಸಲ್ ಈಸ್ ದ ಎಫೆಕ್ಟರ್. ಲಾಸ್ಟ್ ಎಲ್ಲಿ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ, ಯಾವ ಪಾರ್ಟ್ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ ಅಂದ್ರೆ ಸ್ಕೆಲಿಟಲ್ ಮಸಲ್ಸ್ ಎಫೆಕ್ಟ್ ಆಗ್ತಾವ. ಏನ್ ಎಫೆಕ್ಟ್, ವಾಟ್ ಈಸ್ ದ ಎಫೆಕ್ಟ್ ಅಂದ್ರೆ ಇಟ್ ಕಾಸಸ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್. ಸೊ ದಿಸ್ ಗ್ರೂಪ್ ಆಫ್ ಡ್ರಗ್ಸ್, as the name itself suggests, they are known as skeletal muscle relaxants. Some brief information about skeletal muscle relaxant. So skeletal muscle relaxant ಅಂದ್ರೆ ಏನು, ಅದ್ರ ಬಗ್ಗೆ ನಿಮ್ಗೆ ಸ್ವಲ್ಪ ಐಡಿಯಾ ಬರ್ಬೇಕು. ಸ್ಟಾರ್ಟಿಂಗ್ ಹೆಂಗ್ ಆಕ್ಟ್ ಮಾಡ್ತಾವ, ಏನ್ ಯೂಸ್, ಬ್ರೀಫ್ ವಿಲ್ ಸಿ so that you get the gist of it, then we'll go into detail. So skeletal muscle relaxants are the group of the drugs which cause skeletal muscle relaxation. We saw they act. Where do they act? So they act peripherally at neuromuscular junction. So ಒಂದು neuromuscular junction ಆಗಿ act ಮಾಡ್ತಾವೆ, peripherally acting. ಇನ್ನೊಂದು they are known as centrally acting muscle relaxant. So one is they will act peripherally ಎಲ್ಲೇ at neuromuscular junction. Very important group of drugs. So neuromuscular junction or centrally in the cerebrospinal axis. So cerebrospinal axis ಅಲ್ಲೇ ಆಕ್ಟ್ ಮಾಡ್ಬೋದು. ಟು ಕಾಸ್, ವಾಟ್ ಡು ದೇ ಕಾಸ್? ದೇ ಕಾಸ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಟು ಅ ಲೆವೆಲ್ ವೇರ್ ಇಟ್ ಕಾಸಸ್ ಪ್ಯಾರಲೈಸಿಸ್. ಪ್ಯಾರಲೈಸಿಸ್ ಅಂದ್ರೆ ಕಂಪ್ಲೀಟ್ಲಿ ರಿಲ್ಯಾಕ್ಸ್ ಆಗಿ ಅದ್ರ ಮೇಲೆ ವಾಲಂಟ್ರಿ ಕಂಟ್ರೋಲ್ ಹೋಗೋ ತನಕ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಕಾಸ್ ಮಾಡ್ತಾರೆ. ಸೊ ದೇ ವಿಲ್ ಕಾಸ್ ಪ್ಯಾರಲೈಸಿಸ್ ಆರ್ reduce the muscle tone depending upon the drugs, depending upon the dosage, depending upon the circumstances. So that is what you have to understand is ಎಲ್ಲಿ ಆಕ್ಟ್ ಮಾಡ್ತಾವ ಅಂದ್ರೆ ಒಂದು ಪೆರಿಫೆರಲಿ ಆಕ್ಟ್ ಮಾಡ್ತಾವ at neuromuscular junction. They may act on the muscle fiber itself. So muscle contraction ಹೆಂಗಾಗುತ್ತೆ ನಿಮ್ಗೆ ಅವಾಗಲೇ ಕಾಂಟ್ರಾಕ್ಷನ್ ಕಪ್ಲಿಂಗ್ ಅದೆಲ್ಲ ಗೊತ್ತು. ಸೊ ಮೇನ್ ನಾವು ಏನ್ ಬೇಸಿಕ್ ಹೇಳ್ಬೇಕಂದ್ರೆ ನ್ಯೂರೋಮಸ್ಕ್ಯುಲರ್ ಜಂಕ್ಷನ್ ಏನಿರುತ್ತೆ, ಇಲ್ಲೇ ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ರಿಲೀಸ್ ಆಗುತ್ತಾ, ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಹೋಗಿ ರಿಸೆಪ್ಟರ್ಸ್ ಮೇಲೆ ಆಕ್ಟ್ ಮಾಡುತ್ತಾ. ಸೊ ಈ ರಿಸೆಪ್ಟರ್ ಮೇಲೆ, ಸೊ ವಿಲ್ ಮ್ಯಾಗ್ನಿಫೈ ದಿಸ್ ಪಾರ್ಟ್. ಸೊ ದಿಸ್ ಇಸ್ neuromuscular junction. The nerve muscle fiber, this is muscle fiber, so we'll draw it better. So this is the nerve ending, this is the muscle part. So ee junction ಏನಾಗುತ್ತಲ್ಲ, this is known as neuromuscular junction. ಸೊ ಇಲ್ಲೇ ಕಾಂಟ್ರಾಕ್ಷನ್ ಆಗೋ ಪ್ರೋಸೆಸ್ ಇನಿಷಿಯೇಟ್ ಆಗುತ್ತೆ. ಹೆಂಗ್ ಇನಿಷಿಯೇಟ್ ಆಗುತ್ತಾ, ಇಲ್ಲಿ ಇಂಪಲ್ಸ್ ಬಂದಾಗ ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ರಿಲೀಸ್ ಆಗುತ್ತೆ. ಸೊ ವಿ ಹ್ಯಾವ್ ಸ್ಟಡಿಡ್ ಅಬೌಟ್ ದಿಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಮೀಡಿಯೇಟರ್ ನ್ಯೂರೋ ಟ್ರಾನ್ಸ್ಮಿಟರ್, ದಟ್ ಇಸ್ ಅಸಿಟೈಲ್ ಕೋಲಿನ್. ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಬಂದು ಸ್ಪೆಸಿಫಿಕ್ ರಿಸೆಪ್ಟರ್ಸ್ ಮೇಲೆ ಆಕ್ಟ್ ಮಾಡುತ್ತೆ. ಸೊ ರಿಸೆಪ್ಟರ್ಸ್ ಮೇಲೆ ಆಕ್ಟ್ ಮಾಡಿದಾಗ ಏನಾಗುತ್ತೆ, ಈ ರಿಸೆಪ್ಟರ್ ಮೇಲೆ ಏನಾದ್ರೂ ಅದು ಆಕ್ಟ್ ಮಾಡಿದ್ರೆ, ಸೊ ಇಟ್ ವಿಲ್ ಕಾಸ್ ಮೂವ್ಮೆಂಟ್ ಆಫ್ ಸೋಡಿಯಂ. ಐ ಆಲ್ರೆಡಿ ನೋ ದಟ್ ಸೋಡಿಯಂ, ಕ್ಯಾಲ್ಸಿಯಂ ಎಲ್ಲ ದೇ ಆರ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಇನ್ ದ ಡಿಫರೆಂಟ್ ಪ್ರೋಸೆಸ್ ಮುಖಾಂತರ ಆಕ್ಷನ್ ಪೊಟೆನ್ಷಿಯಲ್ ಜನರೇಷನ್ ಆಗೋದಾಗ್ಲಿ, ಆಮೇಲೆ ಅದರಿಂದ ಸಾರ್ಕೋಪ್ಲಾಸ್ಮಿಕ್ ರೆಟಿಕ್ಯುಲಮ್ ಒಳಗೆ ಏನಾಗುತ್ತೆ ಅವೆಲ್ಲ ಗೊತ್ತು. ಸೊ ಅಲ್ಟಿಮೇಟ್ಲಿ ಸೋಡಿಯಂ ವಿಲ್ ಕಾಸ್ ರಿಲೀಸ್ ಆಫ್ ಕ್ಯಾಲ್ಸಿಯಂ. ಇದರಿಂದ ನರ್ವ್ ಮಸಲ್ ಜಂಕ್ಷನ್ ಒಳಗೆ ರಿಲೀಸ್ ಆಗೋದ್ರಿಂದ ದರ್ ವಿಲ್ ಬಿ ಕಾಂಟ್ರಾಕ್ಷನ್ ರಿಲ್ಯಾಕ್ಸೇಷನ್. ಬಟ್ ಒನ್ ನೀವು ಸೂಪರ್ಫಿಷಿಯಲಿನೂ ಹೋಗ್ಬೇಕಂದ್ರೆ ವಾಟ್ ಇಸ್ ದ ಇನಿಷಿಯೇಟಿಂಗ್ ಪ್ರೋಸೆಸ್ ಅಂದ್ರೆ, ಇಂಪಲ್ಸ್ ಟ್ರಾವೆಲ್ ಆಗಿ ನರ್ವ್ ಇಂಪಲ್ಸ್ ಬಂದಾಗ ದರ್ ಇಸ್ ರಿಲೀಸ್ ಆಫ್ ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ವಿಚ್ ವಿಲ್ ಆಕ್ಟ್ ಆನ್ ದ ರಿಸೆಪ್ಟರ್. So at least ಇದನ್ನ ಇಲ್ಲಿಂದ we'll start understanding. So where is this happening? In the neuromuscular junction. So peripherally acting drugs, they will act in the on the neuromuscular junction. Again, it's in the name itself, neuromuscular junction. ಹೌದಾ? ಸೊ ಅಲ್ಲಿ ಆಕ್ಟ್ ಮಾಡ್ತಾವ, ಮಸಲ್ ಫೈಬರ್ ಮೇಲೂ ಆಕ್ಟ್ ಮಾಡ್ಬೋದು, ಅಥವಾ ಇದನ್ನೆಲ್ಲ ಕಂಟ್ರೋಲ್ ಮಾಡೋ ಮೇನ್ ಸ್ಟೇಷನ್ ಯಾವುದು, ಸೆಂಟ್ರಲ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್. ಸೊ some of the drug will act on the central nervous system as well. They are known as centrally acting muscle relaxant. Okay, so this is some basic idea. Yes, before going into detail, you will obviously have this question, where they are used. One of the very less frequently heard group of drugs. ನೀವು ಈಗ ಸ್ಟಡಿ ಮಾಡ್ಬೇಕಾದ್ರೆ ಇದ್ರ ಬಗ್ಗೆ ಯೂಸಸ್ ಬಗ್ಗೆ ಸಿಗ್ನಿಫಿಕೆನ್ಸ್ ಬಗ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಬಟ್ ಟು ಗಿವ್ ಯು ಅನ್ ಐಡಿಯಾ ಎಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ವಿತ್ ಜನರಲ್ ಅನೆಸ್ಥೆಟಿಕ್ಸ್. when we discuss general anesthetic, we discussed that we use skeletal muscle relaxants. So we use different skeletal muscle relaxation to cause muscle relaxation ಬೇಕೇ ಬೇಕು ನಮಗೆ to have ideal operating field. So muscle relaxation with general anesthesia, they play very important role with general anesthetic. So with general anesthetic to provide muscle relaxation for surgery. There are many other uses which we will see. Centrally acting, this is about peripherally acting muscle relaxant. Centrally acting muscle relaxant, they are used in the treatment of painful muscle spasms or spastic neurological conditions. So ille we use this. So again, these are some very broadly, if you want to understand. So this is some brief introduction about skeletal muscle relaxants. Yes, now we have two important group of muscle relaxants. Naven study madidvi muscle relaxant andre ಎರಡು, ಒಂದು peripherally acting, ಒಂದು centrally acting. Okay, so now we will see peripherally acting. So again ನಾವಾಗಲೇ ಹೇಳಿದಂಗೆ ಎಲ್ಲ ಆಕ್ಟ್ ಮಾಡ್ತಾವೆ ಇವು neuromuscular junction. Okay, so neuromuscular junction ಒಳಗೆ ಆಕ್ಟ್ ಮಾಡುವಂತ peripherally acting skeletal muscle relaxant, they are again divided into two groups. That is, one acting at the neuromuscular blocking agents, one they will act directly. Okay, so directly hang act ಮಾಡ್ತಾವೆ. When you see this you will understand. So for time being, just keep this aside, concentrate on this, that is drugs acting peripherally, that in the two in neuromuscular junction. So again we have two important classification. One is non-depolarizing and competitive. See again in the name, so ee name ಬಗ್ಗೆ ನೀವು ನೆನಪಿಟ್ಕೊಂಡ್ರೆ it gives lots of information. So ನೆನಪಿಟ್ಕೊಂಡಿದ್ನ we will relate again when we are discussing about mechanism of action. So one is non-depolarizing competitive blockers. Next is so non-depolarizing, depolarizing blockers. Okay, depolarizing blockers. One is non-depolarizing competitive blockers, depolarizing blockers. So example again based on the duration of action. Now this is also important clinically as well as for your exam. They may ask you to classify muscle relaxant. One of the commonly asked question. So long acting, intermediate acting and short acting. So this is, so ಇನ್ನೊಂದು ಗಮನ ಮಾಡಿ ಕೊಡ್ರಿ ಇಲ್ಲೇ. So they will end with curonium, curium, curonium, curium. So they will end with either curonium or curium. So one way you can easily remember mivacurium, tubocurarin, pancuronium, dexacurium. So curium or curonium in the end actor. So at least start with remembering one or two, later you can understand. So depolarizing ಒಳಗೆ two important, one is succinylcholine. Very commonly asked question, succinylcholine. ಇದ್ರ ಬಗ್ಗೆ at least you have to remember this. Yes, competitive muscle relaxant mechanism of action. ನಾವಾಗಲೇ ಹೇಳಿದೆ ಹೆಸರು ನೆನ್ಪಿಟ್ಕೋರಿ ಅಂತ. Two important terminologies. ನೀವು exam in worst scenario, again I'm not encouraging this, ಏನು ನೆನಪಾಗಲಿಲ್ಲ ಅಂದ್ರೆ you can concentrate on the name itself. There is competitive block. So competitive muscle relaxant will produce competitive block. Because they are producing competitive block, there is no generation of depolarization. So depolarization ಅಂದ್ರೆ ಏನು? So ಅವಾಗಲೇ ಹೇಳಿದ ಎಕ್ಸಾಂಪಲ್ ಅನ್ನು ಸ್ವಿಚ್ ಆನ್ ಮಾಡೋದು ಆಫ್ ಮಾಡೋದು ಎಕ್ಸಾಂಪಲ್. ಸೊ ಆನ್ ಮಾಡಿದ್ರೆ depolarization, that is activation. So depolarization ಆದರೆ sodium movement ಅದೆಲ್ಲ ಆಗುತ್ತೆ. Non-depolarizing, they don't depolarize, they are competitive blockers. So simple. Again, this is the most basic part. We'll see. So block the nicotinic receptors. So neuromuscular junction ಆಗಿರುವಂತ nicotinic receptors ಗೆ they will block. They have very important what they block. How do the fact that they block these receptors cause muscle relaxation or paralysis is they will block the receptors. They have affinity but no intrinsic activity. ಅಂದ್ರೆ so ಇದು ರಿಸೆಪ್ಟರ್ ಇದ್ರೆ so they have affinity ಅಂದ್ರೆ ಈ ರಿಸೆಪ್ಟರ್ ಗೆ affinity ಇದ್ರೆ it will go and bind here. Okay, it will go and bind here but no intrinsic activity. Andre it will not produce any action, it will simply go and bind. So if you remember the lock and key concept of receptors, so affinity andre ಏನು ಯಾದೇ ಕೀ ಆ ಲಾಕ್ ಒಳಗೆ ಹೋದ್ರೆ that means it has affinity. Intrinsic activity ಇದ್ರೆ it should be able to open, for example. So open ಮಾಡೋದು ಏನಾದರೂ capability ಇದ್ರೆ that means it has intrinsic activity. So affinity ಅಂದ್ರೆ ಕೀ ಹೋಗುತ್ತೆ ಒಳಗಡೆ. Many of the keys will enter, ಒಳಗೆ ಹೋದ್ರು ಓಪನ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. That means, so relate here, they will have affinity, they will go simply and bind it, they cannot open. So similarly receptors ಮೇಲೆ ಹೋಗಿ drug competitive muscle relaxant, they will go and they will block the receptor. because they have affinity, but they don't have intrinsic activity. So simply block ಮಾಡ್ತವೆ, there will be no action. ನಮಗೇನು ಆಕ್ಷನ್ ಬೇಕಿಲ್ಲ. ಅಗೇನ್ ವಾಟ್ ಟು ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಏನ್ ಮಾಡುತ್ತೆ, ರಿಸೆಪ್ಟರ್ಸ್ ಮೇಲೆ ಹೋಗಿ ಬ್ಲಾಕ್ ಮಾಡಿ ಇದನ್ನ ಡಿಪೋಲರೈಸ್ ಮಾಡಿ ಆಕ್ಟಿವೇಟ್ ಮಾಡ್ತಾ. ಡಿಪೋಲರೈಸ್ ಅಂದ್ರೆ ಸಿಂಪಲ್ ಟರ್ಮ್ ಇನ್ ಲೇಮನ್ ವೇ. ಡಿಪೋಲರೈಸೇಷನ್ ಆಕ್ಟಿವೇಶನ್ ಮಾಡುತ್ತೆ, ಆಕ್ಟಿವೇಶನ್ ಮಾಡಿದ್ರೆ ಸೋಡಿಯಂ ಮೂವ್ಮೆಂಟ್ ಆಗುತ್ತಾ, ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಷನ್ ಆಗುತ್ತೆ. ಹೌದಾ? ಸೊ ದಟ್ ಈಸ್ ವಾಟ್ ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಡಸ್. ಬಿಕಾಸ್ please pay attention, because it has affinity, it will go and bind. It is having intrinsic activity, it will cause action. What is the action? It will activate, it will depolarize, it will open the sodium channel, it will cause muscle contraction. Whereas these group of drugs, they have affinity, they will go and bind, they don't have intrinsic activity. Now this will cause two things. One thing is it is not activating, so ಅದು ಕನ್ಸರ್ನ್ಡ್ ಏನ್ ಮಸಲ್ ಫೈಬರ್ ಅಥವಾ ಮಸ್ಕ್ಯುಲರ್ ಜಂಕ್ಷನ್ ಬಗ್ಗೆ ನಾವು ಮಾತಾಡಕತ್ತೀವಿ, they will not produce any muscle contraction. ಫಸ್ಟ್ ಥಿಂಗ್. ಸೆಕೆಂಡ್ ಥಿಂಗ್, ಇಟ್ ಈಸ್ ಬ್ಲಾಕಿಂಗ್ ದ ರಿಸೆಪ್ಟರ್. ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಬಂದ್ರು ಅದಕ್ಕೆ ಆಕ್ಟ್ ಮಾಡೋಕೆ ರಿಸೆಪ್ಟರ್ ಅವೈಲೇಬಲ್ ಇರಂಗಿಲ್ಲ. ಸೊ ಇಟ್ ಈಸ್ ಬ್ಲಾಕಿಂಗ್, ಇಟ್ ಈಸ್ ಸಿಂಪ್ಲಿ ಹೋಲ್ಡಿಂಗ್ ದ ಪ್ಲೇಸ್. ಸೊ ಇಟ್ ಈಸ್ ನಾಟ್ permitting acetylcholine to cause its action. So because of this, acetylcholine is not able to combine with the receptors. End plate potential of ನಾವೇನ್ ಹೇಳ್ತೀವಿ, which is required to produce the muscle contraction, is not generated, or even if it is generated, it's very less. It gradually falls, unable to trigger muscle action potential. So action potential ಬೇಕೇ ಬೇಕು. We need for it to be activated to cause contraction. That will not take place. Ultimately, muscle fails to contract even when nerve impulse is produced. Okay. So for example, ಈಗ ನೀವು ಬೈಸೆಪ್ ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಟ್ ಮಾಡೋಕಂದ್ರೆ ನೀವು ಕಾಂಟ್ರಾಕ್ಟ್ ಮಾಡ್ತೀರಿ, ದರ್ ಇಸ್ ಇಂಪಲ್ಸ್, ಇಟ್ ಇಸ್ ಆಕ್ಟಿವೇಟೆಡ್, ಇಟ್ ಕಾಂಟ್ರಾಕ್ಟ್ಸ್. ಓಕೆ, ಇಲ್ಲಿ ಏನಾಗುತ್ತಾ, ದ ಡ್ರಗ್ ವಿಚ್ ಯು ಆರ್ ಗಿವನ್, ಇಟ್ಸ್ ಗೋಯಿಂಗ್ ಅಂಡ್ ಆಕ್ಯುಪೈಯಿಂಗ್ ಆಲ್ ದ ರಿಸೆಪ್ಟರ್ಸ್. ಸೊ ಇಂಪಲ್ಸ್ ಬಂದು ಅಸ್ಟೈಲ್, ಸೊ ಸಿಂಪಲ್ ಇಲ್ಲಿ ಇಂಪಲ್ಸ್ ಬಂತು, ಅಸ್ಟೈಲ್ ಕೋಲಿನ್ ರಿಲೀಸ್ ಆಯಿತು, ಸೋಡಿಯಂ ರಿಲೀಸ್ ಆದ್ಮೇಲೆ ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಷನ್ ಆಯ್ತು. ವೆರಾಸ್ ಹಿಯರ್ ನೀವು ಕಾಂಟ್ರಾಕ್ಟ್ ಮಾಡ್ಬೇಕಂತ ಇಂಪಲ್ಸ್ ಬಂದ್ರು, ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ರಿಲೀಸ್ ಆದ್ರು ಆಕ್ಟ್ ಮಾಡೋಕ್ಕಲ್ಲ. ಎದಕ್ಕೆ? You hogi, they are blocking the receptor, so there is no use. So the muscle is not able to contract, or they will be in a relaxed state. Okay, so that is the mechanism of action. So very simple, the name itself suggests they are competitive, they are competitively blocked. Innone significance andra, don't get confused, just it is what is, there is something known as surmountable. Andra block aithe heng reverse ಮಾಡ್ತೀರಾ ಅಂದ್ರೆ, ಇದ್ರ ಕಾನ್ಸಂಟ್ರೇಷನ್ ನಾವು ಜಾಸ್ತಿ ಮಾಡಿದ್ರೆ, ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಕಾನ್ಸಂಟ್ರೇಷನ್ ಜಾಸ್ತಿ ಮಾಡಿದ್ರೆ ಎರಡು ನಡುವೆ ಕಾಂಪಿಟೇಷನ್ ಆಗುತ್ತಾ, ಯಾವ್ದು ಜಾಸ್ತಿ ಇರ್ತಾ, ಇಟ್ ವಿಲ್ ಗೋ ಅಂಡ್ ಬೈಂಡ್ ಇಟ್. ಸೊ ಲೀವ್ ಇಟ್, ಇಫ್ ಯು ಡೋಂಟ್ ಗೆಟ್ ಕನ್ಫ್ಯೂಸ್ ವಿತ್ ದಿಸ್, ಜಸ್ಟ್ ರಿಮೆಂಬರ್ ಕಾಂಪಿಟೇಟಿವ್ಲಿ ಇಟ್ ವಿಲ್ ಬ್ಲಾಕ್ ದ ರಿಸೆಪ್ಟರ್. there is no depolarization, so that's why it is known, they are known as non-depolarizing. So affinity they have, they don't have intrinsic activity. Acetylcholine is not able to bind on the receptor, no action potential, no end plate potential, hence no muscle action potential is generated, no muscle contraction. So in other words, there is a relaxation of the muscle. Very important to understand this. Next, one is non-depolarizing we have studied, next is depolarizing block. Again, so depolarizing name olagate, there will be depolarizing. Now the question arises, even if there is activation or depolarization, why there is no muscle contraction? So the answer for that is, the answer very simple, andra same, take lock and key. So affinity andra it will go and bind, intrinsic activity will open it, but open madakadre it should have complete intrinsic activity. So completely adu rotate adrashtene lock open agutte. So in other words, receptor mele yadaru ligand bind adre it should have complete intrinsic activity to activate it. So ನೀವು ಲಾಕ್ ನ ಅರ್ಧ ಕೀ ಹಾಕಿದ್ರಿ, ಫುಲ್ ತಿರುಗ್ಸಕ್ ಆಗ್ಲಿಲ್ಲ, ಫುಲ್ ತಿರುಗಿದ್ರೆ ಓಪನ್ ಆಗೋದು, ಬಟ್ ನೀವು ಹಾಕಿದ್ರಿ ಫುಲ್ ತಿರುಗ್ಸಕ್ ಆಗ್ಲಿಲ್ಲ, ಸಬ್ ಮ್ಯಾಕ್ಸಿಮಲ್. ಸೊ ವಾಟ್ ನೀವು ತಿರುಗಿಸಿ ಓಪನ್ ಆದ್ರೆ ದಟ್ ಈಸ್ ಮ್ಯಾಕ್ಸಿಮಲ್. ಸೊ ಫುಲ್ ಮ್ಯಾಕ್ಸಿಮಲ್ ತಿರುಗ್ಸಕ್ ಆಗಲ್ಲ, ಇಟ್ ಕಾಸ್ ಸಬ್ ಮ್ಯಾಕ್ಸಿಮಲ್ ಇಂಟ್ರಿನ್ಸಿಕ್ ಆಕ್ಟಿವಿಟಿ ಇದ್ರೆ then also there is no use. Okay. Even if the drug is having affinity, it should have maximal or optimum intrinsic activity, only then it is activated. Whereas these group of drugs, they have affinity, they don't have maximal intrinsic activity, they have sub maximal intrinsic activity. So complete activation agalla. So depolarize muscle end plates by opening. So first because of submaximal inda ಸ್ವಲ್ಪ ಓಪನ್ ಆಗುತ್ತಾ, but it's not again complete, so it is submaximal. Longer lasting depolarization of the muscle end plate produces repeated excitation. So starting bari submaximal ರಿಂದ ಫಸ್ಟ್ ಸೊ 2 ಫೇಸ್ ಇರ್ತಾವ. ಫೇಸ್ 1 ಹೋಗಿ ಬೈಂಡ್ ಆದ್ಮೇಲೆ ಸಬ್ಮ್ಯಾಕ್ಸಿಮಲ್ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡಿಂದ ಸ್ವಲ್ಪ ರಿಪಿಟೇಟಿವ್ ಹಗ್ಲಗ್ಲಗ್ಲ ಸೋಡಿಯಂ ಎಂಟರ್ ಆಗ್ಬೋದು ಮಸಲ್ ಎಂಡ್ ಪ್ಲೇಟ್ ಒಳಗ. ದಟ್ ಈಸ್ ಫಸ್ಟ್ ಪಾರ್ಟ್. ಸೊ ಇಟ್ ಈಸ್ submaximal, it is not producing the required amount of movement. Second is, and also it will produce repetitive excitation of the fiber. Now again it's not complete. So ಹೆಂಗಂದ್ರೆ muscle contraction produce ಮಾಡೋದು it will cause fasciculation, ಅಂದ್ರೆ full contraction ಇರಲ್ಲ, minimum very very small, so that it will cause. Second thing is, this is first part, it is producing submaximal. ಇಲ್ಲಿ ತನಕ confuse ಆದರೆ don't worry, just remember this, they will go and bind, they don't have complete affinity, their intrinsic activity ಸ್ವಲ್ಪ ಇರೋದ್ರಿಂದ ಸ್ವಲ್ಪ ನೀವು. ಸೊ ಇಮ್ಯಾಜಿನ್ ಲಾಕ್ ಮಾಡಿ ಹೆಂಗೆ ಕಂಪ್ಲೀಟ್ ಓಪನ್ ಮಾಡಲಿಲ್ಲ ಅಂದ್ರೆ ಏನಾಗುತ್ತಾ, ಸ್ವಲ್ಪ ಓಪನ್ ಲೋಕ ಹೆಂಗಾಗುತ್ತಲ್ಲ, ಸೇಮ್ ರಿಸೆಪ್ಟರ್ಸ್ ವಿಲ್ ಆಲ್ಸೋ ಅಷ್ಟು ಓಪನ್ ಆಗೋದು. ಆ ಟೈಮ್ ಒಳಗೆ ದೇರ್ ವಿಲ್ ಬಿ ರಿಪೀಟೆಡ್ ಎಕ್ಸೈಟೇಷನ್, ಬಟ್ ಇಟ್ ವಿಲ್ ನಾಟ್ ಬಿ ಕಂಪ್ಲೀಟ್, ಇಟ್ ವಿಲ್ ನಾಟ್ ಬಿ ಆಪ್ಟಿಮಮ್. ಓಕೆ, ಆಮೇಲೆ ಆ ರಿಸೆಪ್ಟರ್ ಏನು ಬೈಂಡ್ ಆಗಿ ರಿಸೆಪ್ಟರ್ಗೆ ಏನು ಡ್ರಗ್ ಬೈಂಡ್ ಮಾಡಿರ್ತಲ್ಲ, ಇಟ್ ವಿಲ್ ನಾಟ್ ಡಿಸೋಸಿಯೇಟ್ ರ್ಯಾಪಿಡ್ಲಿ ಫ್ರಮ್ ದ ರಿಸೆಪ್ಟರ್. ಸೊ ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಏನಾಗುತ್ತಾ ಬಂದು ಇದ್ರ ಮೇಲೆ ಬೈಂಡ್ ಆಗಿ ಇಟ್ ವಿಲ್ ಪ್ರೊಡ್ಯೂಸ್ ಡಿಪೋಲರೈಸೇಷನ್. ಆಮೇಲೆ ಎನ್ಸೈಮ್ ಬಂದು ಇದನ್ನ ಡೈಜೆಸ್ಟ್ ಮಾಡಿ ಹೊರಗೆ ತೆಗೆದು ಬಿಡುತ್ತೆ. ಸೊ ದ ರಿಸೆಪ್ಟರ್ ಇಸ್ ಅಗೇನ್ ಅವೈಲೇಬಲ್ ಫಾರ್ ನೆಕ್ಸ್ಟ್ ಅಸಿಟೈಲ್ ಕೋಲಿನ್ ಟು ಕಮ್ ಅಂಡ್ ಬೈಂಡ್ ಅಂಡ್ ಪ್ರೊಡ್ಯೂಸ್ ದ ಆಕ್ಷನ್. ದಿಸ್ ಈಸ್ ನಾಟ್ ಹ್ಯಾಪನಿಂಗ್ ಹಿಯರ್. ಇಲ್ಲಿ ಏನಾಯ್ತು, ಬಂದು ಕೂತ್ ಬಿಟ್ಟೈತೆ, ಹೋಗಂಗಿಲ್ಲ. ಇಟ್ ವಿಲ್ ನಾಟ್ ಡಿಸೋಸಿಯೇಟ್ rapidly from the receptor, so the receptor is again not available. So what happens because of this? There is prolonged partial, so this is very important, because of the submaximal, relate that here. So ಸ್ವಲ್ಪ open ಆಗುತ್ತೆ, that is partial depolarization. We are not having complete depolarization. So complete movement ಆಗಲ್ಲ, complete contraction ಆಗಲ್ಲ. So there is prolonged partial depolarization of the region around the muscle plate, resulting in inactivation of sodium channels. So because of this submaximal partial irodinda, sodium channel will be inactivated. In this state, acetylcholine release is unable to generate muscle action potential. Muscle action potential generate madakagala. This will cause, very typical of this, what is known as flaccid paralysis. It will cause flaccid paralysis. So in other words, zone of inexcitability is created around the end plate. So one, though it is having submaximal intrinsic activity, it is producing partial depolarization, hence there is no generation of muscle action potential, causes flaccid paralysis. That is one. It completely causes inexcitation of the receptor. That is first thing. Second thing andre adu receptor na bit hogak ready illa drug, so the receptor is also inactivated. So that is also, there is some changes in the receptor as well. So that is also caused by these group of drugs. Simple ನೀವು ಏನಾದರೂ one sentence ಅಥವಾ two word, very few words ಅನ್ನು ನೆನಪಿಟ್ಕೋಬೇಕಾದ್ರೆ, please remember persistent submaximal activation or persistent partial depolarization and submaximal intrinsic activity ಇರೋದ್ರಿಂದ this will cause flaccid paralysis. So this is how muscle relaxation is caused by depolarizing muscle relaxants. So this is the mechanism of action. So mechanism of action you artha madkondre, that's it. Major part of skeletal muscle relaxant is this. Now you can see the drugs. So drugs ಬಗ್ಗೆ very ಸ್ವಲ್ಪ points ನೀವು ನೆನಪಿಟ್ಕೊಂಡ್ರೆ that's it. The skeletal muscle relaxant, it's most of the part is done. So again, as I told, in depolarizing muscle block produced by the drugs, there is phase 1 and phase 2. Phase 1 block is rapid in onset, result from ಹೇಳಿದೆ submaximal ಇರುತ್ತಾ, persistent depolarization ಇರುತ್ತಾ, repeated muscle entry ಇರುತ್ತಾ, sodium entry ಇರುತ್ತಾ, but it is no use. Persistent depolarization of the muscle end plate and has features of classical depolarization ಇರುತ್ತಾ, but again remember it's partial, it's submaximal. Next, this is seen in phase 1. Phase 2 is slow in onset and result from the desensitization of the receptors. So receptor ಮೇಲೆ bind ಆಗಿ ಜಲ್ದಿ ಡಿಸೋಸಿಯೇಟ್ ಆಗಲ್ಲ, it is not acted upon by acetylcholine esterase, so ಅದನ್ನು ಡೈಜೆಸ್ಟ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ, so it will desensitize the receptor. So it is acting in two phases. Okay, so this is how depolarizing muscle relaxants work. Yes, so what happens ಈಗ ನೀವು ಎಲ್ಲ ಮಾಡಿದ್ರೆ ಏನ್ ಆಕ್ಷನ್ ಪ್ರೊಡ್ಯೂಸ್ ಆಗುತ್ತಾ? ಸೊ ಸ್ಕೆಲಿಟಲ್ ಮಸಲ್ ನಾವು ಮೇನ್ ಟಾರ್ಗೆಟ್ ಎದಕ್ಕೆ ಕೊಡಕತ್ತೀವಿ, ವಿ ಆರ್ ಗಿವಿಂಗ್ ದೆಮ್ ಟು ಆಕ್ಟ್ ಆನ್ ದ ಸ್ಕೆಲಿಟಲ್ ಮಸಲ್ ರಿಲ್ಯಾಕ್ಸೆಂಟ್. ಸೊ ವಾಟ್ ಇಸ್ ದ ಎಫೆಕ್ಟ್? ಫಸ್ಟ್, ನಾನ್ ಡಿಪೋಲರೈಸಿಂಗ್ ಮಸಲ್ ಬ್ಲಾಕರ್ಸ್ ರಿಲ್ಯಾಕ್ಸೆಂಟ್ಸ್ ಏನ್ ಮಾಡ್ತಾವ ಅಂದ್ರೆ ಇಟ್ ವಿಲ್ ಕಾಸ್ ವೀಕ್ನೆಸ್. ಫಸ್ಟ್ ಗೆ ಇಟ್ ವಿಲ್ ಕಾಸ್ ವೀಕ್ನೆಸ್. ವೈ? ದೇರ್ ಇಸ್ ನೋ always when you're studying it's easy if you compare. So non depolarizing or depolarization illa illa. So first it will start weakness, proceeds to flaccid paralysis. But depolarizing enagutta, first there will be submaximal. So allinda progress that we will see. So muscle weakness followed by flaccid paralysis. Now this is important. Order of muscle relaxation: fingers, extraocular muscles, hand, feet, arm, last intercostal muscle and diaphragm. So last involve agada respiratory muscles. So depending upon dose, so idanna ನಾವು ಗಮನ ಇಟ್ಕೊಂಡಾಗ we can give continuous infusion agli dose agli, we have to, this information plays important role. And recovery, so ನಾವು ಇದನ್ನ ರಿಕವರ್ ಮಾಡಿದಾಗ ಅಥವಾ ಅದು ಆಂಟಗನಿಸ್ಟ್ ಕೊಡೋದನ್ನ ರಿಕವರ್ ಮಾಡಿದಾಗ ಸೀಕ್ವೆನ್ಸ್ ಉಲ್ಟಾ ಇಂದ ರಿಕವರ್ ಆಗುತ್ತೆ. ಸೊ ಫಸ್ಟ್ ಡಯಾಫ್ರಾಗ್ಮೆಟಿಕ್ ಪಾರ್ಟ್ ವಿಲ್ ಬಿ ರಿಸ್ಟೋರ್ಡ್. ಸೊ ಇದ್ರ ಮೇಲೆ ಇರೋ ಆಕ್ಷನ್ ಫಸ್ಟ್ ಹೋಗುತ್ತಾ, ಆಮೇಲೆ in the reverse order, it will go in the reverse order. Yes, now again if you understand this, you can understand the mechanism of action even better. So first again there will be fasciculation lasting for few seconds. Yadaka, it is having submaximal, it's not completely zero, it is submaximal. Okay, it's somewhat in between. Okay, submaximal. So submaximal partial irodrinda it will not be complete muscle contraction, it will be what is known as fasciculation, small contraction. Complete muscle contraction irangilla, sumne eno alladadanga agirodu antara full complete contraction agala. First it will produce fasciculation. Why? So relate that there, then you can easily understand. First it will go, it will bind, it has submaximal. So first sodium movement irutta, repetitive movement irutta, but then again it is partial action potential, so there will be fasciculation. Next there will be flaccid paralysis. Okay, but how much baadatiralla, it only for few seconds, then proceeds to flaccid paralysis. Yes, the fasciculations are not prominent in anesthetized patient. So this is one more fact, and the sequence is different from non depolarizing. Starts with neck, limb, face, jaw, trunk, amele respiratory. So both of them will involve the respiratory system at the end. Next, but idu ಎಷ್ಟು ಫಾಸ್ಟ್ ಆಗಿ ಆಕ್ಷನ್ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡುತ್ತಂದ್ರೆ you can't usually differentiate. So that is one important fact. Apnea generally occurs within 45 because of the fast onset of action. So immediately ee order enirtalla ನೀವು appreciate ಮಾಡಕ್ಕಾಗಲ್ಲ. So immediately sometimes within 45 to 90 seconds you may see difficulty in the apnea and the respiratory breathing problem abudu. That means it has involved the respiratory system, so it should be alert. Autonomic ganglia, competitive neuromuscular blockers will produce some degree of blockade. So significant and we'll see what is that. Very important clinically is histamine release. So D-tubercularian ಏನು ಮಾಡುತ್ತಾ, it will release histamine. So histamine ಏನು ಮಾಡುತ್ತಾ, it releases histamine from mast cell. Please remember, it is not because of the immune response. So usually ನಾವೇನು ಗೊತ್ತು ನಮಗೆ, histamine is released from the mast cell secondary to activation of inflammatory process. Here it is not, it has nothing to do with the immune system. It is related to the receptors and molecular other size agirli adradu. So it's not related to the immune system. So ashtu artha ಮಾಡ್ಕೊರಿ ಸಾಕು. So it causes release of histamine, though the action of histamine is same whether it is released because of immune system or because of any other mechanism. Histamine is released. What will histamine do? It will cause hypotension, so blood pressure reduce agutta, flushing, bronchospasm, increase the respiratory system, difficulty in breathing. So one of the limiting factors of drugs like D-tubercularian is this. CVS, yes, one more important system. D-tubercularian produces significant fall in BP. Why? Ganglionic block, we have studied this. Histamine release, it causes reduced venous system. Why? Contraction of muscle idre pump ಆಗ್ತಿರುತ್ತೆ blood, so there is already paralysis of limb and respiratory muscle. So venous return ಏನಿರುತ್ತೆ heart ಗೆ reduce ಆಗೋದ್ರಿಂದ there is reduction in the blood pressure, there is fall in the blood pressure. Whereas other group of drugs, like other drugs, pancuronium tends to cause tachycardia and rise in blood pressure. Some individual points. So then you have to keep in mind, nothing much to explain. You can, all you have to do is remember this. Atracurium may produce hypotension, but the newer drugs like vecuronium or uvella, cisatracurium, they have very negligible effect on the blood pressure and heart rate. Because of this fact, they have gained more popularity. They are one of the common used drugs nowadays. So continuing, cardiovascular system effect of depolarizing drugs, effect of succinylcholine is variable. It's very difficult to predict. Generally, initially there will be bradycardia followed by tachycardia. There may be a rise in the blood pressure due to stimulation of sympathetic ganglion. Prolonged administration of succinylcholine will produce different cardiac abnormalities, arrhythmias, cause ಮಾಡಬಹುದು, especially in children and older age group. So that is one important aspect which should be kept in mind, especially if the patient is already having cardiac abnormalities. Another cardiac condition ittu, athwa they are taking drugs like digoxin, avaga this action will be more pronounced. Also, this is aided by the fact that it will cause efflux of intracellular potassium. Potassium na efflux ಮಾಡುತ್ತಾ. So again, potassium direct agi action ಮಾಡೋದು important organ, heart and muscle. So succinylcholine has varied. So that's why we have used the term variable action on cardiovascular system. Close monitoring is absolutely necessary, especially in children and elder age group with other comorbidities. So this has to be kept in mind. Yadukandra succinylcholine is one of the common used drug to produce muscle relaxant. There are other points about succinylcholine we'll see. Competitive muscle blockers may enhance post-operative paralytic ileus. Yes, some operations will cause. One important fact about CNS, they will not cross blood-brain barrier, so there is no central nervous action. Yes, important factor you have to understand about the drugs is the duration of action. So dose bidri, so nodri the onset of action. So you'll nodri intermediate acting, long acting, short acting, duration of action mele now divide madivi, onset of action. So see here, they are very action ಎಷ್ಟು ಜಲ್ದಿ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ ನೋಡ್ರಿ. So this is in minutes. So succinylcholine 1 to 1.5 minutes, rocuronium 1 to 2 minutes. The action will start in this for 25 to 40 minutes. So histamine release, so ಈ table ಆಗಿ ಎಲ್ಲ summary ಐತೆ. So D-tubercularian ಏನಾಯ್ತಲ್ಲ, so this is the one which has highest causes highest histamine release. So pay attention to this table to understand the onset and duration. So it will summarize the whole features of skeletal muscle relaxant. So illodri D-tubercularian, pancuronium ivella, it will cause histamine release. D-tubercularian highest irutte ganglion block plus vagal block. So ivella effect irodrinda it's not favorite drug, it's seldom used nowadays, whereas here you can see very less effect. So these, especially the newer acting and drugs idavalla, they have very less tendency to cause histamine release agli, ganglion block agli, effect on cardiovascular system, it's very less compared to the older drugs. Yes, D-tubercularian, because of its prominent histamine release and ganglion blocking and action on cardiovascular system, is not used now. Very important drug which is commonly used, one of the most commonly, if not the most commonly used drug is succinylcholine. Not the most, one of the most, especially in intubation. So now agle pre muscle relaxant ಎಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ intubation ಮಾಡಕರ muscle relaxed ಇರಬೇಕು. Succinylcholine is very good in especially in intubation. Tracheal tube introduce ಮಾಡಬೇಕಾದ್ರೆ it will produce very good muscle relaxation. It induces rapid, now agle ನೋಡಿದ್ವಿ 1 to 2 minutes, so it will start complete and predictable paralysis and recovery is within 5 minutes. So this is very important point. Why it is preferred in intubation is it causes relaxed jaw, vocal cords, next diaphragmatic movement ella obtain agutte. So very good muscle relaxant, preferred muscle relaxant because of these properties. Very commonly used in tracheal in intubation. Yes, it is avoided. Now what facts you should be careful about? It is avoided in children, younger children, because of the risk of hyperkalemia and cardiac arrhythmias. have to be kept in mind. Adverse effect andra, so succinylcholine can be asked for 5 or 3 marks. So in that you have to write. Mechanism of action is same. Now discuss ಮಾಡಿದ್ವಿ ಆಗಲೇ. ಇದು next is uses, we'll discuss. Adverse effect is risk. There were some cases where the risk of regurgitation and aspiration of gastric content was seen, especially if the patient already had gastroesophageal reflux disorder in obese patient. So alle this was very commonly seen. Muscle fasciculation, amele soreness, muscle pain adella after recovery it was very commonly seen. And also we have discussed there will be changes in blood pressure, heart rate and arrhythmias. It causes histamine release, it causes potassium efflux. We have studied about this. So all these are adverse effects of succinylcholine. Yes, one more important event which has to be kept in mind when succinylcholine is used is, so succinylcholine ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ it is rapidly hydrolyzed in the plasma by pseudocholinesterase and on the enzyme ಏನಾಗುತ್ತೆ, usually it is hydrolyzed, it is destroyed by it destroys succinylcholine. So because of this the action, duration of action ಎಲ್ಲ maximum 5 to 8 minutes ಆಗಿರುತ್ತೆ. But in some individuals, because of some genetically predetermined condition, so there is ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ, there may be abnormality. So pseudocholinesterase abnormality ಇರಬಹುದು. So succinylcholine metabolize ಆಗಲ್ಲ, hydrolyze ಆಗಲ್ಲ. So ಅದರಿಂದ ಏನಾಗುತ್ತೆ, succinylcholine will be available for very longer duration of time. So 5 to 8 minutes ಎದಕ್ಕೆ ಇರುತ್ತೆ ಅಂದ್ರೆ pseudocholinesterase ಬಂದು ಅದನ್ನ ಹೈಡ್ರೋಲೈಸ್ ಮಾಡಿ ಅದರ ಆಕ್ಷನ್ ನ ಡಿಸ್ಟ್ರಾಯ್ ಮಾಡ್ತದೆ. ಡಿಸ್ಟ್ರಾಯ್ ಮಾಡೋದ್ರಿಂದ there will be no action. But in some genetically determined condition, there may be either abnormality of the enzyme, it may not show affinity towards succinylcholine, or there may be deficiency of pseudocholinesterase. ಅದರ ಕ್ವಾಂಟಿಟಿನೇ ಕಡಿಮೆ ಇರಬಹುದು. ಸೊ ಇದರಿಂದ ಏನಾಗುತ್ತೆ, succinylcholine availability in the body will be prolonged. ಸೊ prolonged ಆದ್ರೆ ಏನಾಗುತ್ತೆ, muscle relaxant ಜಾಸ್ತಿ ಆಗುತ್ತೆ. So now remember, ನಾವು muscle relaxant use ಮಾಡೋಕ್ಕಾದ್ರೆ we use it only, we want muscle relaxation only for specific duration of time. After the procedure is done, we don't want muscle relaxation. We want it to be, the patient to become normal in physiological condition. So ಇದಾಗೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ, succinylcholine action prolong ಆಗುತ್ತೆ. So this will cause what is known as succinylcholine apnea. So this one factor has to be kept in mind. So ಹಿಂಗೇನಾದ್ರೆ ಏನಾಗುತ್ತೆ, paralysis and apnea will be for 4 to 6 hours. Now compare this to here. Okay, that much absolutely we don't want. So this is one factor should be kept in mind. So in that case, usually mechanical ventilation as now usually use ಮಾಡಿ we manage the case. So one of the important adverse effect is succinylcholine apnea. So next drugs, only few characteristic points. Provides good pancuranium specialty ಅಂದ್ರೆ cardiovascular stability, very bari cardiovascular stability cause ಮಾಡುತ್ತೆ. It provides very good cardiovascular stability. Rare ಇವೆಲ್ಲ adverse effect because of lower histamine release. Okay, so cardiovascular abnormality was mainly because of histamine. So it will produce less synthesis or release of histamine. So these adverse effects are less. Rapid IV injection often causes rise in BP and tachycardia. So rapidly ಕೊಡಕ್ಕೆ ಹೋಗಬಾರದು, that is one thing. And because of this, we usually its use is restricted to cardio in neurosurgery. Okay, duration of action ಆಗಲಿ ಆಮೇಲೆ ಇವೆಲ್ಲ ಕನ್ಸಿಡರ್ ಮಾಡಿದ್ರೆ, ಸೊ ಪ್ರೊಲಾಂಗ್ ಸರ್ಜರೀಸ್ ಒಳಗೆ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ನ್ಯೂರೋಸರ್ಜರಿ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನ್ಯೂರೋಸರ್ಜರಿ. Yes, atracurium. One more question which can be asked. Atracurium is 4 times less potent than pancuranium. Now, the unique feature of atracurium andra, it undergoes inactivation by what is known as spontaneous non-enzymatic degradation. So, yadike commonly ಕೇಳ್ತಾರೆ ಅಂದ್ರೆ ಇದಕ್ಕೆ. So, it undergoes spontaneous non-enzymatic degradation, also known as Hoffman's elimination. Okay. So enzyme cholinesterase enzymes act ಮಾಡೋದಲ್ಲದೆ spontaneous non-enzymatic degradation it will undergo. So that is one advantage. So because of this, its action or its dose need not be changed in hepatic and renal insufficiency. So ಆ ಕೇಸಾಗ it can be used safely. So that is advantage of atracurium. So atracurium causes dose dependent histamine release. Yes, can occur. Next, longer duration of time use ಮಾಡಕ್ಕಾಗಲ್ಲ because its metabolite can cause CNS toxicity. Because we have cis atracurium. Cis atracurium same property, ಎಲ್ಲ same, but ಲೆಸ್ ಟಾಕ್ಸಿಕ್. ಇವೆಲ್ಲ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ ಎಲ್ಲ ರೇರ್, ಆಮೇಲೆ ಅಥವಾ ಇಫ್ ನಾಟ್ ರೇರ್ ದೇ ಆರ್ ವೆರಿ ಲೆಸ್. ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದಿಸ್ ಸಿಸ್ ಅಟ್ರಾಕ್ಯೂರಿಯಂ ಇಸ್ ಪ್ರಿಫರ್ಡ್ ಓವರ್ ಅಟ್ರಾಕ್ಯೂರಿಯಂ. Next drug, rocuronium, one of the newer drug. So now discuss madanga, newer drug has very less histamine release, less cardiovascular abnormalities. It is slowly replacing, or it has become alternative to succinylcholine for tracheal intubation. So now we adverse effect discuss madidvi, they are very less or even rare in case of rocuronium. So that's why it is gaining popularity, and it is little metabolized, and it is eliminated in bile. Okay, so some rarely it can cause mild vagolytic action, and it can increase heart rate. So apart from that, it is lacking in all the common adverse effects secondary to histamine release. Yes, one important factor which we have to keep in mind is, so now skeletal muscle relaxant ನಾವು ಏನಾದರೂ ಯೂಸ್ ಮಾಡಬೇಕಾದ್ರೆ we usually use skeletal muscle relaxants with other group of drugs. So pre anesthetic medication ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡಿವಿ, ಅನಸ್ತಿಷ ಕೊಡ್ತೀವಿ, ಪೋಸ್ಟ್ ಅನಸ್ಥೆಟಿಕ್ ಮತ್ತೆ ರಿವರ್ಸ್ ಮಾಡೋಕೆ ಕೊಡ್ತೀವಿ. ಸೊ ದೇರ್ ಈಸ್ ಯೂಶಲಿ ಚಾನ್ಸ್ ಆಫ್ ಇಂಟ್ರಾಕ್ಷನ್. ಸೊ ನಾವು ಅದನ್ನ ಗಮನ ಕೊಡಬೇಕು. ಸೊ ವಾಟ್ ಆರ್ ದ ಕಾಮನ್ ಇಂಟ್ರಾಕ್ಷನ್? ಥಯೋಪೆಂಟೋನ್ ಸೋಡಿಯಂ IV ಜನರಲ್ ಅನಸ್ಥೆಟಿಕ್. ಸೊ ಅಲ್ಲೇ ಥಯೋಪೆಂಟೋನ್ ಸೋಡಿಯಂ ಆಮೇಲೆ ಸಕ್ಸಿನಲ್ಕೋಲಿನ್ ಸೇಮ್ ಬಾಟಲ್ ಅಥವಾ ಸೇಮ್ ಅಪರೇಟಸ್ ಮಿಕ್ಸ್ ಮಾಡಬಾರ್ದು. ಯು ಶುಡ್ ನಾಟ್ ಬಿ ಮಿಕ್ಸ್ಡ್ ಬಿಕಾಸ್ ದೇ ರಿಯಾಕ್ಟ್ ಕೆಮಿಕಲಿ. Very important factor is this. Some of the general anesthetic will potentiate competitive blockers. Competitive potentiate ಅಂದ್ರೆ ಒಂದು ಆಕ್ಷನ್ ನ they will increase the magnitude of the action. So in that case you have to always be careful and adjust the dose accordingly. So ಯಾವ ಅಂದ್ರೆ first is ether, next fluorinated anesthetics, inhalation anesthetics, highest with isoflurane, desflurane, sevoflurane is least, next halothane also least. So they will potentiate the competitive blockers. So when you're using competitive blockers, better to replace them or has to be carefully monitored. Those should be altered accordingly. Nitrous oxide potentiates least, very less, but yes, it potentiates again. Ketamine also intensifies non-depolarizing block. Non-depolarizing agent na ketamine joti use madakare it will cause potentiation. So that has to also be kept in mind. Malignant hypothermia, very important condition ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡಿವಿ. ರೈನೋಡಿನ್ ಅನ್ನೋದ್ರಿಂದ there will be release of excessive calcium. Excessive calcium means there is severe contraction, there is increase in the temperature. So that is known as malignant hyperthermia. Malignant hyperthermia is caused by many anesthetics. One common we have discussed is halothane. One more agent which is very notorious in causing malignant hyperthermia is succinylcholine. So succinylcholine ಏನಾದ್ರು ಯೂಸ್ ಮಾಡಿದ್ರೆ halothane ನ ಅವಾಯ್ಡ್ ಮಾಡಬೇಕು because it will cause malignant hyperthermia. Even succinylcholine can cause malignant hyperthermia. Yes, ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ವಿ ಏನಂದ್ರೆ, ಸೊ ಮಸಲ್ ರಿಲ್ಯಾಕ್ಸೆಂಟ್ ನಾವೇನಾದ್ರು ಕೊಟ್ರೆ we have to reverse the action of muscle relaxant. So how we do? We make sure that the muscle relaxant drugs are digested away or they are destroyed by using anticholinesterases. So reverse the action of competitive blockers. Usually what we use neostigmine. Is almost routinely used after pancuronium and other intermediate acting muscle relaxant. Even after that there is residual weakness. This can cause hypoventilation and hypoxia. So this has to be kept in mind. So patient should be monitored for some time after recovery. But one thing is, even neostigmine, even though it reverses ganglionic block, in some of the patient they may experience hypotension, bronchospasm and other muscarinic action. So to avoid this, atropine should be given as pre-anesthetic medication. So this is one point which should be kept in mind. And to prevent, in case if there is any drug which causes histamine release, so then H1 antihistaminics can be used to prevent the adverse effect of histamine release. Yes, aminoglycoside antibiotics ಬಗ್ಗೆ ಗೊತ್ತು. One of the adverse effect is neuromuscular blockade. So their dose of the competitive blockers should be reduced because they are already causing neuromuscular blockade. Next, calcium channel blockers like verapamil can also potentiate. So history should be elicited. If the patient is taking this, then the drug has to be stopped, or alternative drug. Competitive blockers it's better to keep this in mind. Okay. Next, diuretics may produce hypokalemia. So that is one interaction. So In corticosteroids ಏನ್ ಮಾಡುತ್ತೆ, it has one more interaction with diazepam, propranolol, quinidine. They will competitively block while high dose of corticosteroid reduce. So these are common interaction because we are using different set of drugs when we are giving anesthesia or skeletal muscle relaxant use ಮಾಡಬೇಕಾದ್ರೆ. So this has to be kept in mind. Yes, what are the adverse effects? So first and foremost is, we already said this, what we are concerned is respiratory paralysis. So ಎಲ್ಲ muscle relax ಆಗ್ತಾವೆ, okay, but respiratory muscle paralysis ಆದ್ರೆ there will be no respiration, one of the vital function that has to be kept in mind. So one of the common toxicities is respiratory paralysis and prolonged apnea. So that has to be kept in mind. There may be flushing. So most of the adverse effect we have seen. Why there is flushing? Because of release of histamine. Next, there is fall in blood pressure and cardiovascular collapse. Why? Again, histamine, ganglionic block, muscle avagli relax ಆಗ್ಬಿಟ್ಟಿರ್ತಾವ. So to maintain the blood pressure, there should be contraction of the muscle. ಒಂದೇ ಕಡೆ blood pool ಆಗೋದ್ರಿಂದ there is always chance of hypotension and fall in blood pressure. So that should be kept in mind. Cardiac arrhythmias and arrest have happened with succinylcholine. Yes, succinylcholine causes efflux of potassium along with its direct effect on the heart. So this should be, it's better to avoid succinylcholine in patients who are having cardiac abnormalities. Next, precipitation of asthma. Yes, histamine again produces or precipitates asthma. So this should be also considered. Post-operative muscle soreness and myalgia, muscle pain, myalgia, very commonly seen, especially with succinylcholine. That is one more adverse effect. Malignant hyperthermia we have discussed. Again, the culprit is succinylcholine. So all these are toxicity which should be kept in mind. Yes, where do we use this? So we use as adjuvants to general anesthetics. So very important action is anesthetics ಜೊತೆಗೆ we use. Why we use this? Because first is intubation agli adella, they will help in that. Second, they will produce adequate muscle relaxation. So muscle relaxation ಬೇಕು surgeries carry ಮಾಡಬೇಕಾದ್ರೆ. To cause muscle relaxation without using muscle relaxant ನೀವೇನಾದ್ರೂ ಯೂಸ್ ಮಾಡಿಲ್ಲ ಅಂದ್ರೆ you have to increase the dose of general anesthetic. Now you know that the adverse effect, if you are using more dose, adverse effect also will start increasing. ಎದಕ್ಕೆ ಅದು ಡೇಂಜರಸ್ ಅಂದ್ರೆ it is causing central nervous depression. So adverse effect will be very severe and unpredictable. So that to avoid that, even lighter planes of anesthesia ನೀವು surgeries carry ಮಾಡಬಹುದು when use muscle relaxant. Reduce muscle reflex. ಒಂದೊಂದ್ಸತಿ ಸೊ ನೀವು ಮಸಲ್ ಯಾದನೆ ನೀವು ಏನಾದ್ರು ಸ್ಟಿಮ್ಯುಲೇಟ್ ಮಾಡಿದ್ರೆ ರಿಫ್ಲೆಕ್ಸ್ಲಿ it can cause contraction. So that is avoided when you're using skeletal muscle relaxant. They are especially helpful in abdominal and thoracic surgeries. Minor procedure like intubation, endoscopies, orthopedic manipulation. So allella you can use muscle relaxant. Vicurinium, cisatracurium, ivella most frequently used non-depolarizing agent. Next, succinylcholine is employed for brief procedures like endotracheal intubation, laryngoscopy, bronchoscopy, esophagoscopy, ivella where you don't want to unnecessarily use general anesthetic. So ivella minor procedure here we use muscle relaxant. So they will relax the muscle. So passing the tube will become easy. So these are all the first set of uses. Assisted ventilation in critically ill patient, ICU ಒಳಗಿರುವಂತ patient ಒಳಗ it will be very difficult for them to carry even respiration. So ಅಲ್ಲಿ ಏನು ಮಾಡೋಕ್ಕಾಗುತ್ತೆ, we have to provide ventilatory support to them. There, whether you are carrying out mechanical ventilation, assisted ventilation or intubation agli, so there relaxation of the muscle is very much important. There they play very important role. Either you can use sub-paralyzing dose, complete paralysis alla, just sub-paralyzing dose na continuous infusion use ಮಾಡಬಹುದು ಅಥವಾ based on how much you want you can adjust the dose. Next, in case of, so again nodri uses, again use your common sense. They are relaxing the muscle, so we want relaxing. So it can be used where it is used where the contraction is causing some trouble. So ಎಲ್ಲಿ ನಮಗೆ contraction ಜಾಸ್ತಿ ಐತೆ ಅಥವಾ we want contraction, we are going to use muscle relaxant. So if you think that all these conditions will, you can easily understand these conditions. So you memorize ಮಾಡೋಕ್ಕಿಂತ if you understand this you can easily get to know. So one example is convulsion. So convulsions ಆಗಬೇಕಾದ್ರೆ severe muscle stiffening, contraction ಇರುತ್ತೆ. ಆಮೇಲೆ ECT, electroconvulsive therapy ಕೊಡಬೇಕಾದ್ರೆ patient that can mimic convulsion. So ಅವಾಗಿರಬೇಕಾದ್ರೆ ಏನಾಗುತ್ತೆ, we want muscle relaxant. So these are commonly used. Succinylcholine use ಮಾಡಬಹುದು ಅಥವಾ Vicurinium use ಮಾಡಬಹುದು. Severe case of tetanus and status epilepticus. So epilepticus ಒಳಗೂ ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ವಿ. We use diazepam and there are other drugs, but even if it is not controlled by them, next as a last resort you use general anesthetic or muscle relaxants. So this is about peripherally acting muscle relaxants. Next we have directly acting muscle relaxants. So you ಏನು ಮಾಡಿದ್ವು, they used to block the neuromuscular junction ಒಳಗೆ block ಮಾಡಿದ್ವು. Now we have different group. One important group in drug in that is dantrolene sodium. So now we ಏನು ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ವಿ, for muscle contraction coupling ಏನಾಗಬೇಕು, we want sodium, we want calcium is the most important. So calcium release ಆಗೋದು ಎಲ್ಲಿ sarcoplasmic reticulum ಅಂದ್ರೆ through ryanodine RY-R1 receptor ಅಥವಾ ryanodine receptor ಇಂದ calcium channel sodium sarcoplasmic reticulum ಒಳಗೆ calcium release ಆಗುತ್ತೆ. This calcium is necessary for excitation contraction. Now this drug dantrolene sodium will prevent the release of calcium, that is calcium induced. So calcium first release and that calcium itself will promote the calcium release and there will be contraction. So this drug acts on the ryanodine receptor and it will prevent calcium induced calcium release in the channel, and hence there is no action contraction coupling, there is no contraction, so there is relaxation. Okay, so that is about directly acting dantrolene. Why you have to remember is it is the drug of choice for the treatment of malignant hyperthermia. So ನೀವು ನೆನ್ಪಿಟ್ಕೋರಿ, ನಾವು ಆಗಲೇ ಹೇಳಿದೆ malignant hyperthermia ಅಂದ್ರೆ there is abnormality in the ryanodine receptor, there is excessive secretion of calcium, there is large amount of calcium release, there is severe contraction, ಅದರಿಂದ hyperthermia ಆಗುತ್ತೆ. So this is opposite. So ಇದೇನ್ ಮಾಡ್ತಾ, calcium release and stop ಮಾಡ್ತಾ, hence it is the drug of choice in malignant hyperthermia. But apart from this, why we don't use this? Because of the adverse effect. It will cause muscular pain, it will cause sedation, malaise, it will cause troublesome diarrhea, amele it will cause liver toxicity when it is used for longer duration of time. So that's why we use other drugs. So this is about directly acting muscle relaxants. Next, there are one more group of drug, that is centrally acting muscle relaxants. ಸೊ ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಷನ್ ಎರಡು ಗಂಟೆಯಿಂದ ಕಂಟ್ರೋಲ್ ಮಾಡ್ತೀವಿ. ಒಂದು ಇಂದ ಪೆರಿಫರಲ್ ನ್ಯೂರೋಮಸ್ಕ್ಯುಲರ್ ಜಂಕ್ಷನ್ ಒಳಗೆ ಆಕ್ಟ್ ಮಾಡಬೇಕು, ಬಟ್ ಅಗೇನ್ ದ ಮಾಸ್ಟರ್ ಸಿಸ್ಟಮ್ ಇಸ್ ಸೆಂಟ್ರಲ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್. ಸೊ ಅಲ್ಲಿಂದನೇ ಇಫ್ ಯು ಸ್ಟಾಪ್ ದಟ್, ನಾವು ಅಲ್ಲಿ ಏನಾದ್ರು ಟ್ರ್ಯಾಕ್ ಏನಿರ್ತಾವಲ್ಲ ಅಲ್ಲಿ ಏನಾದ್ರು ನಾವು ಟಾರ್ಗೆಟ್ ಮಾಡಿದ್ರೆ ಯು ಕ್ಯಾನ್ ಸ್ಟಾಪ್ ದ ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಷನ್. ಸೊ ದೀಸ್ ಆರ್ ನೋನ್ ಆಸ್ ಸೆಂಟ್ರಲಿ ಆಕ್ಟಿಂಗ್ ಸ್ಕೆಲಿಟಲ್ ಮಸಲ್ ರಿಲ್ಯಾಕ್ಸೆಂಟ್ಸ್. ಸೊ ಈ ಕ್ವಶನ್ ಬರ್ಬೋದು ನಿಮಗೆ, ಸೆಂಟ್ರಲಿ ಆಕ್ಟಿಂಗ್ ಮಸಲ್ ರಿಲ್ಯಾಕ್ಸೆಂಟ್, ವೆರಿ ರೇರ್ಲಿ ಇಟ್ಸ್ ಆಸ್ ಮೆನ್ಷನ್ ಸಮ್ ಸೆಂಟ್ರಲಿ ಆಕ್ಟಿಂಗ್ ಮಸಲ್ ರಿಲ್ಯಾಕ್ಸೆಂಟ್. ಸೊ ಅಲ್ಲೇ ಯು ಕ್ಯಾನ್ ರಿಮೆಂಬರ್ ಆಲ್ ದೀಸ್ ಡ್ರಗ್ಸ್. Okay, so how that they reduce skeletal muscle tone. So please ನೆನ್ಪಿಟ್ಕೊರಿ, they will not cause paralysis. Paralysis cause ಮಾಡಲ್ಲ, ಬರೀ ಟೋನ್ ನ ರೆಡ್ಯೂಸ್ ಮಾಡ್ತಾವ. ಸಿವಿಯರ್ ಕಾಂಟ್ರಾಕ್ಷನ್, ಸ್ಪಾಸ್ಟಿಕ್ ಕಾಂಟ್ರಾಕ್ಷನ್ ಇರ್ತಾವಲ್ಲ, ಸ್ಪಾಸಮ್ ಒಳಗೆ ಏನಿರುತ್ತೆ, ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಟೆಡ್ ಸ್ಟೇಟ್ ಆಗಿರುತ್ತೆ, that will cause pain. So they will reduce the tone of the muscle, they will reduce the spasm of the muscle, they will not cause complete relaxation of paralysis like peripheral acting neuromuscular junction act ಮಾಡೋದು, they cause paralysis. These group of drugs will not cause paralysis under therapeutic doses. Okay, so please keep that in mind. How they act? Action is on the cerebrospinal axis. ಅಲ್ಲೇ ಆಕ್ಟ್ ಮಾಡ್ತಾವ, they don't alter the central act ಮಾಡ್ತಾವ ಅಂತ don't think that they will affect the consciousness. They will not affect the consciousness. They will selectively depress the spinal and supraspinal synaptic reflexes ಏನಿರ್ತಾವಲ್ಲ, they will target them. So ಆ ರಿಫ್ಲೆಕ್ಸನ್ ಸ್ಟಾಪ್ ಮಾಡೋದ್ರಿಂದ there is muscle relaxation. Remember, there is no paralysis. Muscle relaxant ಅಲ್ಲಿ ಏನು ಯೂಸ್ ಮಾಡಿದ್ವಲ್ಲ ಅದ್ರಂಗ muscle paralysis ಇರಲ್ಲ. So that's why they are usually not used in intubation ಆಗಲಿ, ಅನಸ್ತೇಷಿಯಕ್ಕಿಂತ ಮುಂಚೆ ಯೂಸ್ ಮಾಡೋದಾಗ್ಲಿ, we don't use this. They are used for specific conditions. So where they are used in acute muscle spasm. So muscle spasm, ಯಾವುದೇ ಮಸಲ್ ಕ್ಯಾಚ್ ಅಂತ ನಾವೇನು ಯೂಶಲಿ ಲೇಮನ್ ಟರ್ಮ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಮಸಲ್ ಕ್ಯಾಚ್ ಪೇನ್ಫುಲ್ ಕಂಡೀಷನ್ ಆಗಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಅದರ್ ಗ್ರೂಪ್ ಟಾರ್ಟಿಕ್ಯುಲಸ್ ಆಗಲಿ, ಬ್ಯಾಕ್ ಏಕ್, ನ್ಯೂರಾಲಜಿಯಾಸ್. ಸೊ ಇಲ್ಲೇ ಪೇನ್ಫುಲ್ ಮಸಲ್ ಸ್ಪ್ಯಾಸಮ್ ಇದ್ದಾಗ ದೇ ವಿಲ್ ರೆಡ್ಯೂಸ್ ದ ಮಸಲ್ ಟೋನ್, ದೇ ವಿಲ್ ರಿಲ್ಯಾಕ್ಸ್ ಓನ್ಲಿ ದಟ್ ಮಚ್. ಓಕೆ, ದೇ ವಿಲ್ ನಾಟ್ ಕಾಸ್ ಪ್ಯಾರಲೈಸಿಸ್. ಮಸಲ್ ಕಾಂಟ್ರಾಕ್ಷನ್ ಸೆಕೆಂಡರಿ ಟು ಎಂಗ್ಸೈಟಿ. ಸೊ ಎಂಗ್ಸೈಟಿ ಕಾಸ್ ಆದಾಗ ದೇರ್ ವಿಲ್ ಬಿ ಹೈಪರ್ ಆಕ್ಟಿವೇಶನ್, ದೇರ್ ವಿಲ್ ಬಿ ಇನ್ಕ್ರೀಸ್ ಟೋನ್ ಆಫ್ ದ ಮಸಲ್. ಸೊ ದೇರ್ ಯು ಕ್ಯಾನ್ use this group of drugs. There are some specific condition where neurological disorder there is involvement of cerebrospinal axis involved ಆಗೋದ್ರಿಂದ the tone of the muscle is usually increased. There is severe spasm. Example, in some hemiplegia, paraplegia ಆಗಿರ್ಬೋದು, spinal injuries, multiple sclerosis. So ಈ ಕಂಡೀಷನ್ ಒಳಗೆ cerebral palsy ಆಗಿರಲಿ, ಸೊ ಈ ಕಂಡೀಷನ್ ಒಳಗೆ there will be spastic contraction. So ಅಲ್ಲೇ we use centrally acting muscle relaxants. Yes, tetanus, one very emergency condition, so alle you can use muscle relaxant, centrally acting muscle relaxant. The commonly used drug of choice is usually diazepam. Next, ECT, electroconvulsive therapy olaga we studied succinylcholine can be used, but in those cases sometimes because in cases where you cannot use succinylcholine because of some other modality, because of some other comorbidities, then you can use centrally acting muscle relaxant. In minor orthopedic manipulation, fracture reduction agodagli, so alle you can use these drugs to prevent the painful procedure. So that is about centrally acting muscle relaxant. So very easy. So we studied skeletal muscle relaxant andra first thing, the name itself, it relaxes the muscle. So we discussed about two group, that is peripherally acting, centrally acting. So first centrally acting andra they will act on the cerebral spinal axis, supraspinal reflex ಮೇಲೆ act ಮಾಡ್ತಾವೆ, they will reduce the tone, they will reduce the spastic condition, they will not cause paralysis, they will not cause loss of consciousness. They are used in painful spastic contraction, muscle contraction severe ಇದ್ದಾಗ ECT ಒಳಗೆ ಯೂಸ್ ಮಾಡ್ತೀವಿ, minor orthopedic manipulation ಯೂಸ್ ಮಾಡ್ತೀವಿ. So that is centrally acting muscle relaxant. Peripherally acting ಒಳಗ there are two. One is which acts on the neuromuscular junction, one is which acts directly. Indirectly we saw dantrolene sodium. So dantrolene sodium will act on the ryanodine receptor, prevents calcium release, so there is no contraction of the muscle. It is a drug of choice in the treatment of malignant hyperthermia. That is directly acting. In next neuromuscular junction also we have depolarizing and non-depolarizing or competitive. So competitive ಒಳಗೆ ಏನಾಗುತ್ತೆ, they will just go and bind on the receptors, there is no intrinsic activity, so there is no muscle contraction. Depolarizing ಒಳಗೆ ಏನಾಗುತ್ತೆ, they will go and bind, they have affinity but very submaximal intrinsic activity, partial depolarization ಆಗುತ್ತೆ. So there is first phase ಸ್ವಲ್ಪ contraction ಆಗುತ್ತೆ because there is repeated firing of sodium, but they are submaximal, they are less. So there is persistent partial submaximal. So ee terminologies na use madri. So first phase olaga fasciculation irta, then they will proceed to flaccid paralysis. Second stage is they will desensitize the receptor, so the receptor is not available for the action. So that is about these drugs. Next we saw different drugs in both the group, succinylcholine, atracurium, cisatracurium, revacurium, pancuronium, iverad nodivi, and they are based on their mechanism, based on the duration of action and onset, we use different drugs. So toxicities andra respiratory paralysis or apnea it can cause cardiac toxicity secondary to release of histamine, and muscle pain or muscle soreness cause ಮಾಡ್ತಾವ. And uses andre mainly with conjunction, in conjunction with general anesthetic, it produces muscle relaxation. In case of critically ill patient, you can use in intubation, mechanical ventilation, you can use this. ಆಮೇಲೆ ECT electroconvulsive therapy ಒಳಗೆ ಯೂಸ್ ಮಾಡೋದು, minor manipulations ಆಗಿ ಯೂಸ್ ಮಾಡೋದು. So that is the functions of these skeletal muscle relaxants.